I think we all knew it was coming. It was just a matter of when. Today, Mobile County Health Department officials confirmed the first positive test in the county for the UK variant of the virus. We have Dr. Wendy Murphy from the Health Department back with us. Always nice to get your expertise, Dr. Murphy. We keep hearing this variant is more contagious than the novel coronavirus, but that too is highly contagious. So what makes this strain more contagious?
So, hi, Cherish. Right, we knew this would be coming, and finally, it's here. The first identification of the UK variant in a Mobile County resident. So it is maybe 40 to 50% more infectious or more transmissible than SARS-CoV-2, the one we've been dealing with, and it evades the cells in a little bit trickier way than the parent strain, and so that's what's responsible for its infectiousness. It's important to remember, though, the same prevention measures that will prevent, spread of flu and spread of COVID should be effective against transmission of this UK variant in Mobile County.
Do we need to do anything differently to protect ourselves? I mean, any additional protection?
So I think that we need to be a little bit more vigilant about the protections that we've been doing. We've seen some slipping of, people wearing masks in public and that sort of thing. Lots of celebrations going on the last couple of days and over the weekend demonstrate that. So we just need to be hyper vigilant. Also, still the vaccine is thought to be very effective against this variant. So again, when you are eligible, please get vaccinated to protect yourself and your family.
Has this person who tested positive been around anyone else? Like, do you expect any additional positive tests in the coming days?
So it's an ongoing investigation, and we are spending a lot of time to identify people who were in contact with this person to make sure that the patient and their contacts are staying at home as required during isolation and quarantine to try to mitigate or stop further spread of this variant. We have a couple of different households that are potentially impacted, and we are collecting specimens and testing them, and we should have results in a couple of days. But it will not be a surprise if their household contacts are also infected with this strain of COVID-2. Again, household contacts are at very high risk of contracting COVID from a family member. And since this UK strain is even more infectious, we will not be surprised to find additional contacts, household members or close contacts that have been infected with this UK variant.
What else can you tell us about the person who tested positive? Obviously, I know not a lot, but child, adult, can you give us any indication of which area they're in?
Yeah, an adult in the northern part of the county doing quite well, really had been feeling pretty well, and just has a mild cough and a couple of other symptoms that are probably not related to the infection. But we know this is a young person, and so we would expect that the patient will do well. We are in multiple times a day communication with the patient and the household contacts, just to make sure that if they have, any signs of complication, that they seek medical care early.
So a young adult, and you mentioned the symptoms. Are symptoms typically of this UK variant different than symptoms of the novel coronavirus?
Not that we know of. So, this variant just became sort of well known in the UK in late 2020, and in the US and in January, a growing body of evidence, and we will learn more. But at this point, there's no reason to think that the symptoms are different or that infection is more severe. There was some data out of the UK, very early data, still a lot of work to be done. It says that the the UK variant may increase the risk of death slightly, but again, those were all based on cases in the UK. And now that we have this variant, there are more than 1,200 isolations of this variant in the U.S. And so CDC and NIH and others will be looking very closely to see how this variant is behaving in U.S. populations.
Dr. Murphy, we now know that people who have had COVID once can get it again, which means they can get this UK variant. And I want to touch on something you mentioned earlier. What about people who have had both doses of the Pfizer or Moderna vaccine? How are they going to respond to this UK variant?
So they will have a level of protection against it. I think CDC recently sort of showed their hand in their concern for the variants that are being identified across the U.S. by saying that if you've been fully vaccinated with 2 doses of vaccine and it's been a couple of weeks past that second dose, that if you are exposed to COVID within 3 months, you don't have to quarantine. And that short time period doesn't necessarily indicate a short duration of immunity against the SARS-CoV-2, but I think they're waiting to see how variants will evolve in the United States and how the effectiveness of the vaccine will perform against the different variants. Right now, the current vaccine is highly effective against the UK variant. But again, we're all still living in this science experiment of COVID pandemic. So we will share more information as it becomes available to us.
Okay, we talked to the doctor last week who said boosters may be needed. So is that still the case? I know things change, it seems like daily.
Yeah, we've been saying that a lot through this pandemic, haven't we? So
Yes.
yeah, there is speculation that booster doses may be needed in the fall, either to boost immunity to the parent strain or the UK variant, or potentially to try to provide additional immunity should some of the other variants become widely spread here, should they be transmitted widely through the United States. And the current vaccine is less effective against the what we call the P1 variant. That one originated in Japan and Brazil, and what we call the B1351, which originated in South Africa. So the current vaccine is less effective against those variants. So as we learn more, it will not be a surprise if we see a booster dose that might be needed, and like I say, I wouldn't think it would be before fall, because again, the vaccine manufacturers now have to go back to the drawing board and make some minor modifications in their vaccines to make sure they're effective against these variants.
Exactly. Dr. Murphy, thank you so much for your time. I'm sure we will be talking with you again very soon.
Thank you, Cherish.